Painkillers that raise blood pressure. Yazid asks, can we give Nsaids to patients with hypertension? Today I want to discuss nonsteroidals and hypertension and how nonsteroidal agents can raise your blood pressure. Many people treat headaches and body and joint pains casually, but if you have high blood pressure, some painkillers may be quietly working against your heart. What are Nsaids? Nsaids stands for non-steroidal anti-inflammatory drugs, and common examples include diclofenac, your ibuprofen, naproxen, indomethacin, and celecoxib. Non-steroidal anti-inflammatory drugs are not safe and they raise your blood pressure. Nsaids block cyclooxygenase, what we call COX enzymes. They reduce the protective effects of prostaglandins, and prostaglandins normally keep the kidney blood vessels dilated. They support salt excretion and maintain stable kidney blood flow. When you use Nsaids, this protection is lost. The kidney blood flow drops, the renin-angiotensin-aldosterone system, RAS, is activated, and salt and water is retained, and the BP rises, sometimes within days. Non-steroidals also weaken the antihypertensive effect of BP medications. They counteract common antihypertensives. For ACEs and ARBs, there is reduced vasodilation. For diuretic, there is reduced sodium loss, and the combined effect leads to increased blood pressure and apparent resistant hypertension. That's why people will say, my BP drug stopped working. So for the summary effects of the non-steroidals on BP, they raise your BP by about 5 to 10, they cause salt and water retention, and they reduce effectiveness of certain BP medications. They harm the kidney and they trigger sudden BP spikes. We also discussed that they worsen heart failure in the heart failure awareness series. Who is at higher risk of Nsaids induced BP rise? Be extra careful if you are a young person with secondary hypertension, in the elderly patients, in dehydrated patients, in those with kidney disease and heart failure, and especially if your patient is on ACI, ARB, and diuretic, and those admitted with an acute illness. These can cause the BP to rise dramatically and quickly. Use safer pain treatment options. Paracetamol is the safest. Use topical agents, the creams and the gels. Rest, hydration, using of heat compression, and treat the root cause. And remember one tip, if the BP suddenly worsens, always ask, have you been taking pain medication, and especially non-steroidals? The take-home message and answer to Yazid's question: no non-steroidal is completely safe in hypertension. And if Nsaid is absolutely unavoidable, use the lowest effective dose, the shortest duration, if possible less than 3 days. Preferred safer options, naproxen and low-dose celecoxib, but they may still raise your BP. Monitor your BP and the renal function, and avoid ACI, ARB, diuretic, Nsaid combination. Please share this message so that people may know. To the healthcare providers, use Nsaids in our hypertensive patients if only necessary, and if possible, use safer alternatives. There is no Nsaids that is safe in hypertension, whether COX-1 or COX-2 selective. They will all affect the blood pressure. No non-steroidal is 100% safe in hypertension. Use safer options. Dr. Muthui-Mutua, saving lives one heart at a time.